101. In this video, we will talk about latest pharmacology-related multiple-choice questions for nurses along with the answers and rationales, Part 2. But before we start, please don't forget to subscribe, like and share the channel to encourage us to continue and provide you with all new. Question number 1. A teenage patient is admitted to the hospital due to an overdose of acetaminophen Tylenol. Cholinergic effect. C. Paradoxical CNS stimulation. D. Nausea and diarrhea. The answer is C. Paradoxical CNS stimulation. First generation OTC antihistamines typically have a sedating effect due to their ability to pass into the CNS. However, in some infants and children, paradoxical CNS stimulation may occur, leading to symptoms such as excitement, euphoria, restlessness, and confusion. This is why the use of first-generation OTC antihistamines has decreased and second-generation products are now more commonly used. Reye's syndrome is a systemic response to a virus and is not directly associated with the use of first-generation antihistamines. They don't typically exhibit cholinergic effect, and nausea and diarrhea are uncommon side effects. Question number 4. Reye's syndrome, a potentially fatal illness associated with liver failure and encephalopathy, is associated with the administration of which over-the-counter medication? A. Acetaminophen, Tylenol. B. Ibuprofen, Motrin. C. Aspirin. D. Brompheniramine, pseudoephedrine, dimetap. The answer is C. Aspirin. Reye's syndrome is associated with the use of aspirin, acetylsalicylic acid, in virus-infected children. Children who are given aspirin for pain, fever, and inflammation are at an increased risk of developing Reye's syndrome. Acetaminophen doesn't have a direct association with Reye's syndrome and can be safely given to patients with fever due to viral illnesses. Ibuprofen may cause adverse effects such as gastrointestinal irritation and bleeding, but it has not been associated with Reye's syndrome. Brompheniramine pseudoephedrine contains a first-generation OTC antihistamine and a decongestant, neither of which has been associated with Reye's syndrome. Question number 5. Patients who are allergic to intravenous contrast media are usually also allergic to which of the following products? A. Eggs. B. Shellfish. C. Soy. D. Acidic fruits. The answer is B. Shellfish. Some types of contrast media used for intravenous imaging contains iodine as an ingredient. Shellfish also contains significant amounts of iodine. Therefore, patients who are allergic to iodine may exhibit an allergic response to both iodine-containing contrast media and shellfish. Eggs, soy, and acidic fruits don't contain iodine. Question number 6. A 14-month-old child who recently arrived in the United States from a foreign country with his parents needs childhood immunization. His mother reports that he is allergic to egg and has a history of anaphylaxis. Which of the following vaccines should he not receive? A. Hepatitis B. B. Inactivated polio. C. Diphtheria, pertussis, tetanus, DTP. D. Mumps, measles, rubella, MMR. The answer is D. Mumps, measles, rubella, MMR. The measles portion of the MMR vaccine is grown in chick embryo cell, while the current MMR vaccine doesn't contain a significant amount of egg protein. Children with a history of anaphylaxis to eggs should receive the MMR vaccine in a medically controlled setting where full resuscitation efforts can be administered if anaphylaxis occurs. The hepatitis B, inactivated polio, and DTP vaccines don't contain egg protein and can be safely administered. Question number 7. The Gel and Combs classification system is a useful tool for categorizing allergic reaction and describing patient reactions to drugs. Type 1 reactions, which are immediately hypersensitivity reactions, are mediated by A. Immunoglobulin E, B. Immunoglobulin G, C. Immunoglobulin A, D. Immunoglobulin M. The answer is A. Immunoglobulin E, IgE. Type 1 allergic reaction involves the mediation of immunoglobulin E. Immunoglobulin E binds tightly to receptors on basophils and mast cells, playing a crucial role in allergic reactions. When an allergen binds to IgE on these cells, it triggers the release of various pharmacological mediators, leading to allergic symptoms. While IgG is the major immunoglobulin in the serum, IgE is specifically involved in immediate hypersensitivity reaction. Question number 8. Drugs can cause adverse events in patients, and bone marrow toxicity is one of the most common types of drug-induced toxicity. The most severe form of bone marrow toxicity is A. Aplastic anemia, B. Thrombocytosis, C. Leukocytosis, D. Granulocytosis. The answer is A. Aplastic anemia. Aplastic anemia is a severe form of bone marrow toxicity resulting from a hypersensitive reaction, and it is often irreversible. It leads to pancytopenia, which is a significant decrease in all types of blood cells, including red blood cells, white blood cells, and platelets. Aplastic anemia causes a reduction in red blood cells, making hemoglobin level drops, a decrease in white cells, making the patient susceptible to infection, and a decrease in platelets leading to difficulty in blood clotting. Treatment for mild cases involves supportive care, while severe cases may require a bone marrow transplant. Option 2, 3, and 4 are all related to elevated cell counts, which are not indicative of the most serious form of bone marrow toxicity. Question number 9. Serious adverse effects of oral contraceptives include A. Increase in skin oil followed by acne, B. Headache and dizziness, C. Early or mid-cycle bleeding, D. Thromboembolic complication. The answer is D. Thromboembolic complication. Oral contraceptives have been associated with an increased risk of serious adverse effects such as stroke, myocardial infarction, and deep vein thrombosis. These risks are higher in women who smoke. An increase in skin oil followed by acne is an effect of progestin excess, while headache and dizziness are effects of estrogen excess. Early or mid-cycle bleeding is an effect of estrogen deficiency. Question number 10. The most serious adverse effects of allopurinol prostin VR pediatric injection administration in unit is A. Apnea, B. Bleeding tendencies, C. Hypotension, D. Pyrexia. The answer is A. Apnea. While all the listed options are potential adverse reactions of allopurinol administration, the most serious one is apnea, which can occur within the first hour of drug infusion, particularly in units with congenital heart defect. Clinicians using allopurinol must be prepared to intubate and mechanically ventilate the infant if apnea occurs. Close monitoring for apnea or respiratory depression is essential, and in some cases, elective intubation may be performed prior to initiating the medication. Question number 11. Your patient contacts the clinic today reporting pain in both legs while taking atorvastatin Lipitor for high cholesterol. You advise him to A. Discontinue the medication and schedule an appointment for next week. B. Continue taking the medication and schedule an appointment for next week. C. Stop taking the medication and visit the clinic today. D. Engage in at least 30 minutes of walking and inform you if symptoms persist. The answer is C. Stop taking the medication and come to the clinic to be seen today. Muscle ache, soreness, and weakness can be early signs of myopathy, including rhabdomyolysis, associated with the use of HMG-CoA reductase inhibitors like atorvastatin. It's essential to evaluate the patient immediately to rule out myopathy. as continuing the medication or delaying evaluation can worsen the condition. Exercise will not reverse myopathy, and delaying diagnosis may lead to complication. Question number 12. Which of the following adverse effects is linked to levothyroxine synthroid therapy? A. Tachycardia. B. Bradycardia. C. Hypotension. D. Constipation. The answer is A. Tachycardia. Levothyroxine can induce hyperthyroid-like syndrome, including tachycardia, especially at higher doses. It doesn't typically cause bradycardia. Hypotension would be a side effect of bradycardia, not levothyroxine. Constipation is a symptom of hypothyroidism, not an adverse effect of levothyroxine. Question number 13. Which of the following adverse effects is specific to metformin glucophage therapy, ubiquinate diabetic drug? A. Hypoglycemia. B. GI distress. C. Lactic acidosis. D. Somnolence. The answer is C. Lactic acidosis. Lactic acidosis is the most dangerous adverse effect associated with metformin administration. Also, it's relatively rare. Metformin doesn't induce hypoglycemia but can cause some gastrointestinal distress like nausea, vomiting, and diarrhea. Somnolence is not a specific adverse effect of metformin. Question number 14. The most severe adverse effect of a tricyclic antidepressant TCA overdose is A. Seizure. B. Hyperpyrexia. C. Metabolic acidosis. D. Cardiac arrhythmia. The answer is D. Cardiac arrhythmias. Excessive ingestion of TCAs can lead to life-threatening wide QRS complex tachycardia, which is a serious cardiac arrhythmia. While seizures can occur, they are generally not life-threatening. TCAs do not cause hyperpyrexia or metabolic acidosis.